Hot compress versus cold compress. Choosing between hot and cold compression depends entirely on the timing and type of your injury. Cold compression is used to reduce swelling and numb sharp pain from fresh, acute injuries within the first 48 hours. Conversely, hot compression is used to increase blood circulation, loosen stiff joints, and relax aching muscles for chronic pain. What is the mechanism of action of both these compresses? The mechanism of action of hot and cold compression differs fundamentally depending on whether the tissue is experiencing acute inflammation, sudden, destructive fluid buildup, or chronic inflammation, long-term, stagnant cellular stalling. In case of acute inflammation, we use cold compression. Cold compression treats sudden injuries by causing vasoconstriction of local blood vessels. This narrowing restricts the rush of blood and fluids to the damaged area, which stops severe swelling and prevents bruising. Finally, it numbs the local nerves to block sharp pain signals from reaching the brain. On the other hand, for chronic inflammation, we use hot compression. Hot compression treats long-term inflammation by causing vasodilation of blood vessels. This widening creates a surge of fresh blood flow that flushes away trapped metabolic waste and acids, responsible for causing the chronic ache. This increased circulation delivers oxygen and nutrients to repair old, worn-out tissues. Let's discuss their differences in details. Scientific name. Cold compress is also known as cryotherapy. Hot compress is also known as thermotherapy. Primary mechanism of action. Cold compress constricts the blood vessels, causing vasoconstriction. Hot compress dilates blood vessels, causing vasodilation. Blood flow. Cold compress drastically decreases local circulation. Hot compress drastically increases local circulation. Impact on nerves that cause pain. Cold compress numbs local pain receptors, nociceptors. Hot compress blocks pain via thermal gate control theory. Impact on tissues. Cold compress reduces elasticity of tissues, thus it tightens structures. Hot compress increases elasticity of tissues, thus it loosens structures. Types of inflammation in which they are used. Cold compress is used in acute inflammation. First 48 hours of inflammation. Hot compress is used in chronic inflammation. After 48 hours of inflammation.